is information. We take it for granted that people have information about how HIV is transmitted, but it is not necessarily true. There is what we call comprehensive knowledge, and the Ministry of Health has done studies around that. And they have found that there's still persistent misinformation. You can't believe, that some of the things we take for granted about how HIV is transmitted and how you can prevent yourself from getting HIV is not known to most of the public out there. You cannot get HIV by sitting with somebody or beside somebody who is HIV positive, by sharing a cup with them, by shaking their hand, by hugging them, by eating or drinking from the same cup. You can definitely get HIV, or you increase your risk of getting HIV. HIV is predominantly sexually transmitted, especially here in Uganda. So sexual contact with somebody who is HIV positive, when you're HIV negative, you're putting yourself at very high risk. Mother-to-child transmission is the other method. Sharing needles and other sharps. If one person is HIV infected and the other one is not, increases the chances. And those are predominantly the major ways. In the older days, the olden days, blood transfusion used to be, but it no longer is, because blood transfused in our hospitals is largely safe. And if you are taking blood from an accredited health facility, you're not at risk of acquiring HIV. But also, in addition to the methods in which you can acquire HIV, there are also what we call risk factors. If you have multiple sexual partners who are not, your permanent partners, you're increasing the risk, especially if you don't know the HIV status of your sexual partners. If you're not using condoms correctly and consistently with your sexual partner whose HIV status you don't know, or if you know it and it's positive, you're increasing your risk of getting HIV. If you're engaged in transactional sex, you're at risk, because somebody who has paid you, it reduces your power to negotiate for safe sex. So multiple concurrent sexual partnerships, inconsistent, incorrect, or non-use of condoms, transactional sex are some of the risk factors. The other risk factor is income inequality. But again, those categories, because of vulnerability related to income, they are forced to look for ways of survival, and that pushes the individual into transactional sex, and therefore highly exposes them. I've dwelt on that area because when I mentioned young people, I saw the body language. One of you was questioning why, so I went ahead to preempt that question even before it comes. So